Well, we have made it through today's agenda. You want to take a look at? We have.
Then we can recess.
If you would like to recess, we can recess and come back tomorrow.
Chelsea's.
Yes? Yes. Chelsea, did you want to talk to me individually or in front of the council?
I can talk to you guys right now, that's fine.
Okay. Otherwise, we can have you come back tomorrow.
She's here. Yeah, she's
Yeah.
here. We've
Okay.
got time.
She's here now.
Okay.
She's kind of a busy person.
So I was looking through numbers, and I did several scenarios with the third full-time truck as far as doing just a peak truck and doing it with 2 people and just doing it 10 hours a day and then doing it 20 hours a day. And as I got to looking down in my budget, the amount that I had given Michelle for this, I had given her the wrong one. And it was without 2 positions. And so because of that, the EMT line, that was $143,918 should have been $237,895. So,
And which page was this?
Page 61,
No, I mean, oh, it's in, not in this?
account 10220. Yeah, page 61.
so I just wanted to talk to you about that because it was an increase of $93,977. That is my fault, and I did not see that until yesterday as I was going through. So we had tried to do different scenarios to see how to do a third truck with the least amount of people. Decided that 4 people doing it would be the best versus the 6 that would be on 2448. But then we also tried to do just 2 people, and I had wrote out that whole budget, and I gave Michelle the wrong one, and I just realized that, so.
I got a couple of questions since we're at this point.
Go ahead.
So that's gonna have to be the bottom line over on the other page.
Yeah,
How much, 200?
So it would be, the 2 positions that I left off would equal $93,977. So the total would be $2,036,480. If I take the third truck off completely, which included the 5% for them, it would be, you'd subtract $304,166.
So you're about 1.7.
Yeah, so my total would then be 1.768. It's $1,768,314.
Okay, that's it. Let me, and that would include your.
Yeah, that would include the 5%.
If I read through everything yesterday, the third truck wouldn't come into play. Now, excuse me, the increased rates to pay reimbursement wouldn't come into play until July. Is that correct?
That's correct.
Okay.
And the third truck would not be a position, that would not be the way we would operate without the contract from the hospital and
That was my second question. So right now, you're asking us to do something we may not possibly be able to do. Since you're a reverting fund, okay, which means money in, money out stays there.
Oh, you
And
just say
this is what I
reverting
want you
or
all-
non-reverting?
Uh,
Did you say reverting or non-reverting?
non-reverting.
Okay.
Since you're non-reverting fund, the reason I asked for the homework you all were going to do. Pretty much, I think you have to have your revenue stream lined out to cover your budget. So we can't appropriate right now because there's a cap. If you can't start running transfers, funneling money in to cover costs Of course, I realize you're not gonna start it till you have the permission to do it. But my point is this. Right now, your income level is about 1.2 on insurance. And you got a 425 stipend from, so you're only at about a little under 1.6. So, unless somebody comes, we have to have, in order to approve the budget for the amount you would ask for, you all would have to increase your stipend to cover the cost of the debt, and you wouldn't have that covered,
Yes.
okay?
I know that so first off, I know that I have to still talk to ambulance billings. I know you had asked for like what we were recouping, because when we asked for what our average recoup for the transfers was, that was the number they gave me, that was from 2018. And I know that you had asked for some numbers. I don't have those yet, but I wanted to come in here today because as soon as I realized that those two positions had been left off and that I was not meeting where I needed to be, I wanted to make that very clear to you that I had left those off.
But we appreciate that.
I also know that I don't know when this contract with the hospital is going to happen. I know that they don't expect when that whole thing goes down, that it's going to be a ton of notice. And so that's why whenever I turned this in a month ago, I was just trying to prepare for the possibility that we might be to that point now.
Right.
We might be to that point in December, or we might be into that point
Yeah.
May
Well, I
of next
appreciate
year,
what
you know.
what you're doing. I'm just saying, in order to do it, you know, if we appropriate something that we can't fund something we haven't appropriated for, and if your funds are not there to do what you want to do, until somebody says, I'm going to kick in the difference on the stipend, even if you haven't started it, so the funds is there. They're there backed up by stipend money. So my point is, there's a possibility the transition to transfers could take place until that contract. And is that March, April, May?
Yeah.
There has to be.
We'll also have the additional funds.
That's time.
We'll also have the additional funds from the hospital. That would be the per diem amount. That would also try to help offset some of those expenses.
That revenue stream does not start till the service starts, and then there's a lag time between invoice and collection,
Yes.
okay? One of the reasons I wanted comparison numbers from the old Medicare pay sheet to the new one you give us yesterday was take a look at the potential based off of past of what the increase in revenue would be, so we could factor that in, because we know in July that takes place, okay?
Yeah.
So that's kind of where I'm at with the number deal, is do that, but maybe we submit for a budget without the third truck, which could never be realized if they don't sign the contract with us.
Yeah. Yeah.
Okay. And then, here's the reality. At the point in time you see you're there, you have your numbers if whoever's on the council and commission wants to come back at that time, ask for an additional appropriation to cover those costs of doing business. You can do that at the point of implementation. Does that make sense?
Yes. Yeah, and I appreciate you clarifying that then.
But I still, I've got 6 months left, so, well, less than that. But if we had those things, we could get a good estimate on what additional revenues would be from the change in the law, or the reimbursement schedule versus the potential income from transfers. Of course, the transfers is kind of historically pan out based off of assumptions. And my second deal is, you'll be adding some slots, but was you gonna have to add more people to your payroll to do the third truck?
Yes, there was
Six, or
There was
you just
4.
corrected something before? Okay,
So if we did a 24/48, which is what the other full-timers are on, we would require 6 positions for the third truck. Whenever I went through, and this is why I had made the mistake on doing this, is because I had tried to see, can we do it with just 2 people? Can we afford 6? Is 4 possible? And so that, I had wrote out all of that for the payroll portion, and
that
that,
would be a tough one, wouldn't it?
then I got that confused, and so then that's what I had given her. So the 4 would be, if we did the 4, they would have 50 hours a week. They'd have 10 hours of built-in overtime. We would do from 8 to noon would be an on-call. Mike and I can possibly make, if the county gets really busy, statistically that's our slower time of the day. So Mike and I could try to bump that and work that out, or we could have on-call. And then from noon to 10 would be 2 people on. And then from 10 p.m. to 8 a.m., we have 2 more people on. So they work Monday through Friday. We have 20 hours a day of third truck coverage. Where we have an extra medic or 2, we would just bump them, so that way we keep all 3 of our trucks medic trucks. And then the weekend, we were going to try to cover that with just part-time, which would then keep them out of overtime, and we keep the hours down. That is what, in my head, ideally, we want 6 people, but I also don't want to go full send and have 6 people and then realize that we have to back down and we're not able to make, we're not bringing in what our expenses are. So that's why I went with the 4, and with the understanding that if we cannot manage that, then there's the potential for the 6, but we're trying our best to make it work with 4.
Sounds like a better deal to me when you explain it like that, to go that way, in case you have to back down.
Yeah,
Because like I say, historically, the transfers run within, like say, 10% one way or the other, if I remember correctly. And my memory's fading, so I may not remember correctly. But from a budgeting standpoint, I don't think we should budget more than we know for a fact exists at this given time, knowing you've already got a plan in place. You would have time to implement the money. It would just be an additional appropriation, okay? But it wouldn't have money tied up in appropriations till the time needed.
Yes.
That's what we'd be bringing you back. May not have to bring you back now. Unless somebody else got some, I don't know.
I had talked to Chelsea about that, the way I understood this, that there may be some, I called it setup money or starting money, to where once that's done, then, then the money would have
But
to,
you're only putting in 425 right now.
yes,
You would have to put that startup money
yes,
in right now at this time in order to implement that, if you knew for a fact you were implementing that,
right.
which I don't think you're at that point.
No, and then that's what I was talking with Chelsea, that makes that conversation over there very important.
But I'm going to restate, if you think you're at that point, you need to act now. If you think you're, but here again, I don't know.
I
I'm
don't
gonna leave it
know.
up to you guys to decide how strongly. You have the information, I don't. It's up to you all, decide as a board what you wanna do, and we'll consider it as a council. Okay?
So whenever you take, if you take the third truck away and that whole, going down that route with transfers, if we don't have that, we're gonna have the on-call expense that's gonna be more. Because we're gonna have, what we had put in the budget for, what I had put in was for $10,000 for on-call. Now, if we take, that would include us having those 4 other people that were there during the day. So we're not gonna, if we don't have that, we're gonna have more of an on-call expense. Where we spent like $36,000 last year on on-call. So if you take adding on-call back, you take the third truck off, you add on-call back, and then you add what I put in the salary and the 5%, and then medical supply increase and the fuel budget increase, it would be an additional $108,000 from last year is basically where that's at. So it would be,
From last year,
yes,
100 and how much?
108,000.
So you said your total.
So you're gonna be a little bit, you're 1.6 million.
So it would be 1,768,314
Without the third.
without the third truck, adding back the expense of on-call
And the raises.
and the raises and the medical supplies going up and then the fuel going up. So,
And then based on your calculations, you said there's still a deficit between the supplement of the commissioner's budget and their
Well,
revenue.
Your historical, yeah, you're at about 1.2, right? Collections
yeah,
and 425, so that's 1625. So you need to adjust that to match her number. And either decide to go from there or leave it with the third truck in there and find the difference between what you're bringing now and the third truck. That's the way I see it.
so the end of June, we were at around $500,000 what we had brought in. So,
So you're at your 1 million.
yeah. But we are also coming in, we had a couple months like April and May that are statistically our lower months. And then as we come into like the end of the year, our deposits start increasing just because we have these like slow periods. So we have had a couple slow months, like the April and May deposit. So, but if I go back and look at, we ended 21 with 966,550 without the subsidy. So technically we are on track to do better with our deposits so far this year. So. But at the end of June, we were at almost 500,000.
So is that good or bad?
I mean, we're better than what we were last year, what we're averaging. We haven't came into our busy months yet either, and we are still averaging more than what deposits were last year.
End of year receipts. Forget the stipend, just insurance. 21. What was the end of year receipts?
Sorry, I just got off of that. For last year was 966,550.
Okay.
And we ended June at 500,000.
Last year?
This year,
This year?
yes,
But you only took in 900 last year. Period.
yes.
Was that an abnormal year?
I would have to go back and look at 19, or 20 and 19. I don't have that with me, but I can get that for tomorrow.
Well, I guess you see that point. I'm looking at averaging 2 or 3 historical years. You just put together, based off of the history of receipts over a given period. And I'm saying is, you guys as a board, decide what you want to do. And tell us the number you want us to appropriate based off of being able to cover financially based on your average receipts, chip in the difference between your average receipt and your stipend to get to cover your budget.
So Ben, I added those numbers of what Chelsea had from last year plus a stipend, so it's 1.391,550.
But I'm asking
I know,
to do
well,
a history. I'm asking the board to look historically and then complement based off of history to cover the third truck if you want to implement it
do you want
on the
that?
first of the year.
Do you want that number now?
well, their truck is
I
gonna be
want what we
$700,000
said.
difference.
On the budget,
No, it's an estimate. Yeah, 550,000
well, that's what I would estimate too.
over and above the current stipend.
Right, over and above.
Yes,
Yeah.
yes.
Oh, that's doing the third truck.
If with the third truck,
Yeah,
give or take.
well, is anybody seeing where I'm coming from with your decision?
Yes.
Okay,
We don't know what we don't know.
and here's the deal. You're gonna be putting in 500 some odd thousand that you may not get back. Can you all let us know by the end of the Thursday or whatever? Just let us know what you want the budget to be.
And Ben, are you also suggesting that what they asked for matches an average receipt, the average annual receipt plus the surplus, or plus the supplement?
That's what I'm asking.
That's what you're asking. So just based on last year's numbers, you know, that's, like I said, 1,391,550, and last year they asked for 1.6. So that alone, just based on last year's numbers, was $300,000 different than making it match.
So,
Yeah.
just tell us what you think before you need to be.
And even though you have a change in your Medicare, Medicaid rate, that needs to be considered too.
But that's,
Well,
doesn't
I thought
start
I'd already answered that.
second half of next year.
Yeah,
By getting the other numbers compared.
right.
And
That
keep
does
in mind,
Doesn't start till middle of next year.
middle of next year.
they start the middle of next year. You won't start receiving them
For
till
45
about
days.
September
Yeah,
next year.
So I would be concerned if we keep it at the old rate.
Taking it in to get them back.
yeah,
That's all I'm asking, Chelsea.
okay.
Is that fair?
Yeah, that is, I will get the deposits that we have had over the 18, 19, 20, 21, and then, I know yesterday you had said something to me about talking with ambulance billing to see what we're averaging from transfers now, because that amount that they had given us was, back in 2018. So we could potentially be bringing, we could be averaging more for the transfers that we're bringing in now.
But
And
it's
then-
in Valley's bigger than average.
Yeah,
Are you using all the runs that you made on transfers, including the ones you didn't, that had no pay with them, which is, you write off, everything you write off is probably private pay or,
yeah,
so, yes, my point is, if he only averages the runs paid, that number goes up, but you still made the run.
yes. And use the supplies and the expense and all that.
Exactly. So get the number of runs, and he may be doing that, but I don't think he is.
Okay.
And if I'm wrong, I apologize right now. But make sure you understand how you got your number. Because I can play with numbers all day long. I ain't even an accountant, but but yeah, if you do that, you'll have a good feel, a real good feel, I think, where you're gonna be.
Okay. I will have those hopefully by tomorrow. I just didn't want to wait because as soon as I realized that, I just wanted to get in here and let you guys know I made a mistake, so.
See, that makes me feel stronger about you. But,
Chelsea.
thank you.
All right, thank you.
Any other questions?
Wasn't that bad, but
All right, thank you, Chelsea.